Thank you for choosing Compassionate Psychiatric Services for your mental health needs. My name is Fatima Chowdhury. I'm a physician assistant as well as the office manager. We are proud to serve our community in its most vulnerable times with a team of dedicated providers to the wellness of our patients. At Compassionate Psychiatric Services, we provide treatments for a wide range of mental health conditions. Our team is trained in treating depression, anxiety, bipolar disorder, autism, ADHD, just to name a few. We strive to provide advanced therapies utilizing leading technologies while maintaining a caring, safe, and compassionate environment for all of our patients. If you've tried more than 2 medications for depression, you may have what's called treatment-resistant depression. TMS, or Transcranial Magnetic Stimulation, Spravato, and pharmacogenetic testings are a few of the progressive treatment options available at our facility for treatment-resistant depression. Today, we're going to talk to you about TMS.
Hi, I'm Seher Zara. I'm the Director of Counseling and TMS Services at Compassionate Psychiatric Services. TMS, or Transcranial Magnetic Stimulation, is the application of magnetic stimulation to the left dorsolateral prefrontal cortex of the brain. The magnetic stimulation increases production of serotonin and helps the brain to activate neurons that have reduced their functioning due to chronic depression. TMS is a painless and side effect-free procedure performed in our office by our trained and certified technicians. In a series of 36 daily treatments, patients can sit back and relax through the procedure. TMS can be performed in as little as 3 minutes per session.
The reason why patients come in daily for treatments is our brain is a muscle, and just like any other muscle, it requires repetition. TMS is based on repetition. We're training our brains to make these neurotransmitters that are lacking. Now we're going to do a demonstration of TMS. In our office, we have 2 types of TMS machines. We actually have NeuroStar, which is the very first chair that came out for TMS. We also have the MagVenture chair. In the MagVenture chair, patients typically wear a cap. This cap allows us to find the portion of their brain that needs the stimulation. During your very first treatment of TMS, we will be trying to obtain what is called a motor threshold, or MT. The MT is how much stimulation is necessary to stimulate your brain. This varies from patient to patient and significantly differ based on the medications that you have tried in the past. There are certain requirements before a patient can qualify for TMS treatments. First, a patient has to be suffering from either major depressive disorder or OCD. You will have an appointment with a provider who will determine if TMS would be an appropriate treatment for the symptoms that you are suffering from. Once that determination has been made, we will look at your insurance to see if TMS is a covered service. If it is, we will normally submit a prior authorization to your insurance to obtain approval and essentially for insurance to cover the service. Probably 90 to 95% of the time, TMS is a covered service and is paid through by insurance. Patients have little to no out-of-pocket costs for the treatments. Once that process is done, it normally takes anywhere from 1 to 2 weeks from the first consultation that you have with your provider to the very first treatment of TMS. Once we have obtained the prior authorization, we will contact you to schedule your very first treatment. There are many benefits to TMS. A lot of patients that go through TMS report complete resolution of their depression symptoms. They're actually able to taper off of the vast majority of the medications that they're taking, and they have good success and good remission for an extended period of time. TMS has been out for over 10 years now, and they're actually able to go back to some of the first patients that did TMS, and those patients sometimes still report very good success, and they still report reduction in their depression symptoms. Here are some real patients that have benefited from TMS treatment in our office.
My name is Jennifer Safer. I started out coming here for psychiatric services, medication management, and I found that after a while, medication alone wasn't working for me. Depression can be like a rabbit hole, and found myself going down the rabbit hole again from my medication, and it wasn't working well. Dr. Muhammad suggested I try a TMS treatment.
I'm Cameron. I've been going here for about 6 months. I'm receiving TMS treatment. Symptoms before were daily physical stress, just mood swings, depression. It had been going on for too long. I was ready to do something about it. I had tried a lot of medications and I'd been in therapy for a while and nothing really was working long term, and my symptoms kept returning. So my doctor recommended TMS, so I gave it a try and stuck with it, and I'm glad I did because it's really helped.
TMS helped me in so many different areas of my life, such as wanting to get up in the mornings, interact with other people, take better care of myself, bathe myself, just the small, simple things, exercise, go to work, have a better attitude.
It's helped me in a lot of ways. My anxiety level, day to day, I just feel more engaged with, my family and my work. I'm more present, I guess. It's something other people notice also that they tell me about. They're like, oh, you seem more patient or more, I'm less likely to get upset, as I was. I would say I'm a little more future-oriented, maybe that I wasn't before. So I'm definitely thinking about planning more, looking forward to things more.
TMS is a great supplement when your medication stops working or you just hit that wall. I think it's a great supplement to go in and try TMS.
I would fully recommend it to anybody, especially people that have tried other things that didn't work.
TMS is not something you should be afraid of. It's a painless treatment. It really works. It can benefit others. Something you can do in a matter of weeks, and the benefits, outweigh any fears you might have.
People should know that it isn't like pseudoscience or isn't, something that is still kind of, being discovered. It's been around for a while, and it's effective, and it was effective for me.
If you or one of your loved ones is suffering from treatment-resistant depression, please reach out to us, and our team of dedicated providers will assist you in making the best decision for your treatment. You can find more information about us at www.compassionatepsychiatry.org or call us at 469-200-4093.